Welcome back with another episode of Real Talk. We're back with our weekly episode with our good friend over here at the Lieutenant Governor. We want to thank Park Bank for everything that you're doing. Thank you for Facebook Journalism Project for supporting us. Brother, how you doing, man?
Doing all right, man. Had a little mishap today where I damaged a phone. So, happy Monday.
Are you one of those people who, like, without their phone, you just feel like vulnerable, like you just feel like you're not yourself? Is your phone part of you?
It kind of is, but the thing about it, man, I'm way too connected, man. I got my Apple Watch. I got the 4G version, so I don't necessarily need my phone. And then I still have my iPad also. So I guess it's one less thing to have. Now that I think about it, at least for the next day or so until I get a new one.
Yeah, it's funny. Like, I'm trying to now disconnect, and by leaving my phone, it's how my way of disconnecting. You can totally do it, but at first you're like, "Oh, my phone!" Like, I need to. So it's like you have to train yourself to like let your phone alone and put it in another room and like go. It's not easy. What you're saying?
It is not easy at all, and then, I mean, especially like just kind of where we are, like just the amount of people that reach out to us about whatever. I mean, regardless if it's somebody in my office, where they just need a quick answer, where they'll call or text.
Yeah.
It's hard to be away, but I do. Fortunately, I'm not completely just in the void.
Yeah, it's one of the downsides being connected, of being so accessible to people, right? You're like me. You like everyone have access to you, and I'm the same way, man. So I'm always like touching, and like it's just always a communication. Always to the point my kids are like, "Dad, at the table you can't have your phone anymore." So I'm like, that's where I'm at. That's where
you are.
So, bro, again, I always start this off by saying a lot has happened since the last time we talked. So let's talk about this COVID-19 thing. Let's talk about it. Like let's
talk about it.
Let's talk about it. Like again, this is not. I want all my people to understand. The 365 folks out there, I love y'all. We got Republican people watch us. We got Democrats, liberal, all across the board. So I'm not trying to take shots at the Republican Party. I'm really not. I'm just trying to look at the data and the facts. Okay, the facts say we reopened our state. Before that, we were going in the trend that we were supposed to be going, right? We mean all the metrics that you laid out, that you and the governor laid out, we're starting to meet those metrics. We now open back up the state, and our numbers are going off the charts, right? So the only logical correlation is saying that we opened up too early.
Mm-hmm. Bounce back like a Super Bowl.
Right. And so some people would say, we're just testing more people, but that's, if you start looking at infection rate and all that stuff, that that's not what's going on.
Right.
But as part of it, we are testing more people, but you look at the real start breakdown of data, that's not what's going on. And now younger people are getting it, right? So what's your take on what's going on? Like, why do you think, one, that we're getting more people who are infected? Two, what do you think the state should be doing from here?
Yeah, I mean, so obviously I feel like as a state, the Supreme Court should have never lifted safer at home. But, it's up to people to be responsible for themselves and responsible for others now. And there are sacrifices. And like I said, from the very beginning, we're all making sacrifices in this moment. And what we can't afford to, I would say we can't afford to go back to where we were, but we were worse off than we were before. And I think that people should consider what that means even going into the fall, where we're going to be into the typical cold and flu season. And, we don't need both of these going on at the same time, because there are health impacts associated with influenza. And there is a real likelihood that we can meet or exceed hospital capacity. And that's going to spell out real danger for people all across the state, all across the country, honestly. And that's just not a place we should want to be. I think about like Anthony Fauci, where you got Donald Trump, who's now discrediting Anthony Fauci. Anthony Fauci, he was like our personal trainer, and we had the United States had been disciplined, and we were in the gym. Theoretically speaking, we were in the gym for weeks, for a couple months. we saw a couple games and decided that, all right, well, we're done now. We opened ourselves back up to bars and restaurants, and now the situation is out of control. We're seeing the health impacts as a result of us not staying in and staying focused, disciplined, and regimented.
And what's interesting to me is that clearly, if it keeps going how it's going to impact schools. So all the people are talking about impact. They want to open back schools up, and especially as people want to open the economy up and they want to open back schools. But how we're now seeing this impacting kids. I think 4 kids died in Texas. It's starting to have a broader impact, and so this is going to go into school. So everything that people want are going against now. So now what do we do with school? Because the number's going to keep increasing. What do we do?
Yeah, man, and I'm glad you brought up schools too, because you think about Dane County where cases are surging. If think about what opening school looks like. You are bringing tens of thousands of students or people from all across the country, back to the campus. And that's kind of the scariest part about it. States all across the country with large universities, which is every state, are going to be bringing people back on the college campuses, potentially. And the amount the amount of harm that can cause is, I don't think we're ready for that. And I said theoretically speaking earlier. Figuratively speaking, my mind is still thinking about my damaged device. I'm all over the place. Man, I am stressed out right now about that, because there's just extra money I had to shell out. And it's
man, I get it. I would be the same way. It would ruin my whole day, my week.
Man,
till I get a
definitely
new
ruin my day, man. Just an expense that I didn't even need. Now it's
So you didn't mention K through 12s but think about K through 12 schools, because you're talking about colleges, right?
Yeah, but I'm talking about colleges. I feel like that was important to think about, because people aren't traveling as much. But when school starts and folks start to go back to campus from whatever state they live in, whatever country they live in, when they're not in school, we're bringing, you are just creating these mixtures that could be, what could potentially become virus mixtures across the country and pockets of college towns across America. But K-12, that's even worse. If you think about how difficult it is to get some elementary school kids, some kindergartners to distance, say 6 feet away from each other. It's not going to happen, man. It's not going to happen. And, even middle and high school students who haven't seen each other in months, right? You think you're going to stop? They think they're not going to be, socializing, gathering, hanging out. And it's going to be real tough.
Yeah. And just the college life, the dorms, think of it in the dorms. The college kids are going to want to go out, go to the bars. Then if you said high school kids, there's no way in the world you're going to tell high school kids that you put them back in the school that they have to social distance. That's not going to happen. And you're right for K through 12. My gosh, I don't know what to say. But which leads me though to an interesting topic of how you see how the Trump administration is now saying people who are coming from other countries who want to study virtually now. He's saying that they can't do that. He's trying to block them from doing that.
Right. Which is, that's just that's not a decision that he made with people's health in mind. That's a decision he made with xenophobia in mind. The same xenophobia that got him elected, the same xenophobia that he's governing with, making people afraid of people who are from other countries. And that's a shame. I'm happy that our state joined the other 16 and DC in a lawsuit to stop that new rule that will require international students to take their colleges in person for their visas to be valid. Right. That's any attempt that he can make to prevent foreign students, people who are from other countries, to limit their access to this country, to make them or to make people be afraid of them, or to castigate them in this sort of way. That is to the tune of everything else he's done in the last 3.5 years. So, I'm happy that we joined a lawsuit. I think it's important. And you think about UW-Madison, just Madison alone has 5,800 students who will be impacted. UW-Milwaukee has about 1,200. And fortunately, the college community, university community across the state and largely across the country is stepping up against these attacks as well. Even Tommy Thompson said the UW system supports this lawsuit that challenges that rule, which is a good thing. It's not only short-sighted. It's not only meant to harm students, but it also prohibits universities from being flexible, and it hinders the flexibility of universities to adapt to COVID-19 and to keep students and grad students, teaching assistants, faculties from spreading the virus.
And we would think it would also impact their revenue, right? You would also think that would be less money that they would be getting if they're cutting that revenue stream off. I mean, I know people don't want to talk about it from a money perspective, but it seemed like from a money perspective, it would cut off some revenue.
Well, yeah, and that's the thing, because we know that obviously it may not be safe for students to go back to school. We're going to let science guide that decision. But we're getting to that point where we're less than a month away from many schools reopening, a little more than a month for others. And, just placing that ultimatum on students to either put their health at risk or be forced to return back to their home country is something that is just like, I mean, compared to the other things he does and has done, it doesn't seem like, like I said, it's par for the course. But again, you just keep looking at these things, regardless of how egregious they are, and it just, I twist my face up at it because how just ridiculous it is.
Who for the state decides when the state opens, if the state opens up back to schools in the fall? Is that DPI, or who makes that decision?
I mean, that will fall on DPI, but I don't imagine that happens without consultation, whether it's the governor's office or Department of Health Services, and even the Department of Children and Families to make sure that we are being smart about this, making sure that we are, using the same science that drove the decision to implement safer home or even mask policies. And, I think that at the same time, there is still flexibility for local school districts to also make that decision as well. Don't quote me on that, even though we're on video. But, I know that a lot of school districts do intend to go ahead and reopen on their own, especially those with smaller populations or areas where they haven't been that many cases.
Yeah. It's going to be a tough decision either way, right? I mean, both ways, there's true impacts on both sides. So I don't envy Miss Stanford over there, Taylor over there, to make that decision. So that's
I don't either. I don't envy anybody that has to make that sort of decision. But I know one thing that we're also doing as administration, we're going to be shipping more than 2 million masks and more than 4,200 infrared thermometers to K-12 public, charter, and private schools. And the Department of Agriculture, Trade, and Consumer Protection is going to be working with us to facilitate the delivery of about 60,000 masks to our local food processors, restaurants, grocers, and even convenience stores.
You mentioned masks. I know that, in Dane County, at least, they're saying that people have to be mandated to wear masks if they're inside. I think Dane County is the only place in the state doing that right now.
Milwaukee, I believe, is getting ready to do one.
Okay.
But today, Dane County's mask mandate goes into effect for anybody age 5 and up. I mean, this applies to businesses, healthcare settings, waiting in line, public transportation, or even going to somebody else's house.
Right. And so that's interesting that, Dane County takes lead. It's interesting you said Milwaukee's going to do it too. Because my question was, is there a way that the governor he can't officially, I know the local people they can make their local laws, but is there a way he can make a call and say, hey, Tom Barrett, hey, Sadia, can we, Mayor Sadia, Mayor Tom, can we try to do something locally to try to coordinate that? I mean, is that something that he's...
Well, yeah, the governor can, work with whatever leaders in local government, be it cities or counties, to try to work with them. But as we know, legislature They repeatedly tried to, they're going to repeatedly oppose us at every step with their rhetoric and also their lawsuits. And so even having a statewide mask mandate, which a lot of people, keep calling for online, that'll severely limit, what we can do, because what the Supreme Court decided. I mean, we are very limited in being able to, implement that sort of decision making because of the Supreme Court.
Yeah. All sad stuff. I mean, one, I want everyone out there to be safe and take care of yourselves and take this seriously. I mean, I know some people are thinking you're superhuman right now in the summer, you want to get out there, but this is real. And you see more people dying, being more affected by this. So I hope sincerely you guys are taking this seriously. If you don't worry about yourself, worry about the people you might infect, like your parents or your grandparents or, so what you reading, bro? I got reading this book called Diversity Inc. by Pamela Newkirk. It's a real good book. She's talking about how D&I work and how inclusion and diversity work hasn't really worked, and the models have to change how you get into that stuff. So I'm just really interested in that. So
good point about that is because I see so many like D&I specialists, professionals, what have you, and it's like I just don't get how a lot of them got into those positions, man. And like I tell you, the worst thing after all the marches and protesting was seeing like actual D&I professionals talk about how they have so much more to learn. It's like, you've been making six figures all this time and you still got stuff you need to learn. So you've been out here being a charlatan, gallivanting like some professional who just totally gets diversity and inclusion, making all this money with somebody who was likely more well prepared to take on this challenge, this position, is sitting trying to figure it out, man. And it just like stresses me out because the people that get into these positions, and it's like, to be a person that's leading diversity and inclusion, like these are folks who you look at their friend base and it's not diverse or inclusive. I mean, and the thing too is like you can have people who have, friends of different races, but it's like if you don't have people from or know people from different socioeconomic statuses, then you really just don't know. Because if your friends that or it don't even have to be your friends, but if the people you know and have experience with are in the same, economic situation as you are, regardless of race, that their story is gonna be much different than somebody who's dealing with some challenges, a person that is on a different rung of the economic ladder. So I get real frustrated about that, man. These people, and like you think about like all the time these folks have been in a position, how many people have been, how much disservice has taken place all the while this person was leading this diversity and inclusion effort, but didn't know what they were doing.
This is so real, right? So like, there's so much stuff we talk about, and I want to talk about later, but we're doing some stuff on the side. We're telling you some pro-profit business coming, and it's interesting doing the research on all this stuff, Mandela, is because Lieutenant Governor Mandela, is that you're right. A lot of this D&I stuff is failing. A lot of it's failing. And I believe a lot of it's failing because you have people who are going into those roles who don't necessarily have the experience. Now, they might be learning, right? They might be learning from it, but they might be being certified, but they don't have the experience in it. And so I think in this field, experience has to trump everything else because it's something that people live and they have to figure out how it actually works and implement it. And I think that it's interesting how when it comes to this, it seems like sometimes businesses are willing to take the easy way out and just hire anyone who says and put a title on it and just kind of go away so they have the title and not actually people that can do the work. And the data's showing. I'm like doing this research. It's interesting. Like practitioners come in, they stay like 2 years at the most, they're gone. So it's just interesting to see. And so it's interesting to hear you're passionate about it because it's clearly the new thing to talk about, but I'm trying to figure out how do we make it work and be effective at doing it. So, yeah. So what about you over there, Rick Ross? Would you read anything else?
No, just reading like just different reports and studies, man. Just all over the place with that. That's been taking up my time.
Yeah. Any new music?
It is called, what is this album called? I think it's called Dinner Time. It's Kamasi Washington, Ninth Wonder. Who else? Who else is on that album? Oh man, it'll come to me. Ninth Wonder, Kamasi Washington. Is Robert Glasper, and it's one other person, man. And I hate that I'm forgetting this one name.
But that's nice though. I mean, that's a nice combination.
It is, man. It is. It's a little chill too. It's a chill vibe.
Yeah, I can tell.
It's called Dinner Time. Who is that other person, man?
Dinner Time. Is that what it's called? Dinner Time?
Yeah, man.
I'm gonna get that. I'm gonna check that out. That sounds like I said, right now, look for anything I'm trying to feed myself mentally, physically, spiritually. Anything can nourish me like that. So like any good music I'm looking for uplifting me. That's why I was talking about John Legend last time.
Oh,
so
yeah.
So anything that's uplifting, I can, I would love to check that out. So I'm gonna get that as soon as we get off this interview. So, sir, thank you again, Black Man, for everything you're doing.
Man.
Sorry about your phone. I'm laughing with you. Now that I'm laughing with you now that you.
What's done is done.
And so we wish you well, brother. Stay safe, stay healthy, and we'll see you next week.
Appreciate you, man. Take care.
Appreciate you too. Lieutenant Governor Mandela Barnes, thank you for joining us, and we'll see you next time on Real Talk.